So looking back at my video, I felt like I did pretty well with addressing my patient and asking if he was ready to start some learning. A lot of times in the hospital, I feel like my patients are ready to go, ready for their discharge instructions. They just want to leave. But I think sometimes maybe they could be kind of preoccupied. Maybe they're eating lunch. Maybe they're, just woke up from a nap. They're not necessarily ready. So I think that's an important thing, is to talk to them and make sure they're ready. And I think that will improve their adherence once they leave the hospital. I think another thing I did right was like explaining to my patient the physiology of heart failure without going too in depth, because I think that is a pretty difficult thing to understand. And I think that, especially for me, I work on a heart failure unit. Most of my patients don't really understand why they're having these kinds of issues. And so I think it's super important to explain rationales so that they can understand better, why do I need to take my Lasix? Why do I need to limit my salt intake? Why do I need to weigh myself every day? Because these are things that, if you don't understand the rationale, I don't think it makes a lot of sense to continue doing them just because somebody told me to. So I felt like I did good with that. I liked that I was able to give resources. And I mean, with my patients in real life, when they're being discharged, I do give them a whole booklet of information that they need to take home, and they can look through it, and I highlight important things so they're not sensory overloaded with all the literature there. But it's nice to be able to use something like the American Heart Association as a reference. And also, the materials I give are similar to the American Heart Association, but they're like my facilities guidelines. So I thought that was good. I felt like kind of a mistake I made was kind of spieling, but I think that probably is a little bit better when I'm in person talking to a patient, because they're able to respond back to me, and I can kind of pause and allow for absorption. I can kind of like assess their face. Like if they look confused, I might be able to stop and reevaluate how I worded something and like reteach. But obviously without a real person as my patient, it's a little bit hard to assess that. But I think that was really the biggest thing, was that I kind of spoke quickly. And so I think I should take that into account when I'm teaching my patients discharge instructions.